are going to discuss the upper limb, revise. We will start with the joints first. The first joint which we come across in the upper limb is shoulder girdle. Shoulder girdle is a combination of two joints, sternoclavicular joint, which is compound, complex, saddle joint. Because first rib is also involved, it is compound, and because articular disc is there, it is complex. So sternoclavicular joint and acromioclavicular joint. Then they will ask you the movements happening at shoulder girdle. The movements happening at shoulder girdle are 6. Elevation of the scapula and depression of the scapula. Elevation of the scapula happening by trapezius and the levator scapulae. Depression happening mainly by gravity and very rarely by the lower fibers of trapezius. Now elevation, depression, all this happens. The angle is at the axis is passing through the medial angle of the clavicle. Elevation, depression, elevation, depression. Protraction, retraction. Protraction and retraction. They happen with the angle vertically passing at the medial end of the clavicle. So around this axis, protraction, retraction. Protraction is brought about by the punching muscle, serratus anterior. Okay? It is also brought about by pectoralis minor. While retraction is brought about by middle fibers of trapezius and rhomboidus major and rhomboidus minor. Then there is forward rotation and backward rotation. Axis of forward and backward rotation is along the clavicle. Along the clavicle. Forward rotation and backward rotation. Backward rotation happens by gravity. And forward rotation happens by upper and lower fibers of trapezius and serratus anterior. And serratus anterior. Then comes the shoulder joint. Multi-axial ball and socket joint of synovial variety. The articulating surfaces of the shoulder joint. Medially there is glenoid and laterally there is the head of humerus. Then there is capsule. Capsule is attached to the glenoidal labrum medially and laterally to the anatomical neck of the humerus. It extends inferiorly below the neck, below the surgical neck, extends inferiorly to the surgical neck. The capsule is also loose on the inferior side. There are 4 ligaments of the shoulder joint. How to remember them? 2 gleno, okay, and 2 humero. gleno and 2 humeral. What are the 2 gleno? The 3 glenohumeral articulations and the glenoidal labrum. There are 3 glenohumeral ligaments: superior, middle, and inferior. And 2 humeral, transverse humeral and coracohumeral. Transverse humeral and coracohumeral. Transverse humeral runs from greater tubercle to lesser tubercle, plastering the long tendon of biceps brachii. Coracohumeral runs from the base of coracoid to the neck of the humerus. This joint is fortified anteriorly, superiorly, and posteriorly by the rotator cuff muscles. Which is subscapularis anteriorly, superiorly supraspinatus, and posteriorly infraspinatus and teres minor. There is also a coracoacromial arch in the articular surfaces. Coracoacromial arch, which serves as a secondary socket during overhead abduction. Blood supplied by superior, anterior and posterior circumflex humeral arteries, suprascapular arteries. Vidita madam. Oh, she is from Bongla, therefore I just congratulated her. Coracoacromial arch. Then comes the nerve supply is mainly by the axillary nerve. Nerve supply is mainly by the axillary nerve. Mainly by the axillary, there are some other nerves also in the movements, like suprascapular nerve. Movements, flexion, extension, then abduction, firstly adduction, medial rotation, lateral rotation, and circumduction. So these are the actions. Flexion is brought about by anterior fibers of deltoid. Extension is brought about by posterior fibers of deltoid. Adduction is brought about by pectoralis major, latissimus dorsi, teres major. Medial rotation is brought about by pectoralis major, latissimus dorsi, teres major. Okay? Even extension is brought about by latissimus dorsi, pectoralis major, and teres major. So in short, this lady between two majors are responsible for three actions: medial rotation, extension and adduction. Abduction is brought about by supraspinatus and deltoid up to 90 degrees. Up to 90 degrees. Okay? Supraspinatus and deltoid up to 90 degree. Beyond 90 degree, it is brought about by upper and lower fibers of trapezius. Upper and lower fibers of trapezius and serratus anterior. Upper and lower fibers of trapezius and serratus anterior. Lateral rotation is brought about by short lateral rotators. Teres minor, and infraspinatus. And circumduction is the combination of all these movements. In applied anatomy, we write frozen shoulder. Okay? Then shoulder tip pain. Shoulder tip is supplied by C2, C3. Diaphragm is supplied by C2, C3. So any pain is. Then we write about shoulder dislocation. Okay? And in any joint, we write about shoulder replacement. Then we move on to the next joint, that is elbow joint. Elbow joint is a joint of hinge variety. Okay? A joint of hinge variety where superiorly there is capitulum and trochlea of the humerus, and inferiorly there is the head of the radius and trochlear notch of ulna. Capsule is weak anteriorly and posteriorly, and on the lateral side there are two strong collateral ligaments. And the diagram of those two ligaments is very important. So now I am drawing the diagram of medial side, and this is the diagram of the lateral side. Medial side there is ulna, and starting from the medial epicondyle, there are three bands: anterior band, posterior band, and intermediate band. So that is ulnar collateral ligament. विदिता मैडम हमारी वोटिंग को नहीं गए थे, तो मैंने उनको बोला था कि बंगाल में एक भी कैंडिडेट अगर एक वोट से हारता है, तो देन शी वाज प्रेइंग यस्टरडे कि बाबा किधर भी कुछ भी ऐसा हो, मेरे कॉन्स्टिट्यूएंसी एक वोट से फर्क नहीं पड़ना चाहिए। इसके लिए मैंने उनको, वो बच गई वो बेचारी प्रे कर रही थी। कल शाम से वो मेरे को मैसेज करे, सर अब सब ठीक है सर, एक वोट से मेरे कुछ इतना फर्क नहीं पड़ा। और कितना का फ्लाइट का रेट? 8,000 रुपये ज़्यादा है, तो एक दिन के लिए जाना आना, ए वन वे 8,000, तो 16,000 रुपीज़। मैं बोला वो सब तो जा मत जा, बट एक वोट से कोई हारना नहीं चाहिए। And the lateral collateral ligament or the radial collateral ligament lateral collateral ligament and radial collateral ligament. There is annular ligament over here. Annular ligament over here. And this annular ligament के अंदर radius का head ऐसे ऐसे घूमता है. The radial collateral ligament runs from the lateral epicondyle to the annular ligament. It is not attached to radius. Although उसका नाम है radial collateral ligament, it is not attached to radius. Okay. Then इसका nerve supply सबसे easy है. सारे nerves, medial nerve, radial nerve, ulnar nerve, musculopubic. इसके actions दो ही है, flexion and extension. Extension brought about by triceps, flexion brought about by biceps, brachialis and brachioradialis. Applied anatomy of elbow joint, very easy to remember, very easy to remember. Student elbow, then golfer elbow, then tennis elbow. कुछ नहीं आता है. फिर बचपन cold elbow. Medial epicondyle pain, golfer's elbow, lateral epicondyle pain, tennis elbow. Then comes the wrist joint. Wrist joint. Wrist joint, ulna doesn't participate. There is lower end of radius, lower part of the radius, and articular disc of the inferior radioulnar ligament. Radius and articular disc of the radioulnar ligament, and then there is scaphoid, lunate and tricuspid. Scaphoid, lunate and tricuspid. That is the articulating surfaces. Scaphoid, lunate, tricuspid. Again here there are two collateral ligaments on the side, medial side and lateral side. Medial, radial collateral, ulnar collateral. Both of them starting from the styloid process. Of the radius styloid process of ulnar. One going to scaphoid, one going to tricuspid. Then there are anterior radiocarpal ligament, posterior radiocarpal ligament. अभी अल्ना कार्पल लिगामेंट भी लिखा है उधर आपके बुक में. Okay. This wrist joint is ellipsoid type of a joint. Ellipsoid type of a joint. इसके चार एक्शंस है, फ्लेक्शन, एक्सटेंशन, adduction and abduction. Flexion is brought about by flexor carpi radialis, flexor carpi ulnaris. Extension is brought by extensor carpi radialis longus, extensor carpi radialis brevis, and extensor carpi ulnaris. Adduction is brought about by both ulnaris, flexor carpi ulnaris, extensor carpi ulnaris. Abduction is brought about by flexor carpi radialis, जो radial side पे है, and flexor carpi radialis longus and brevis. Okay. Wrist joint inflammation can lead to carpal tunnel syndrome. There is ganglion, very common because of friction seen on the wrist joint. Then suddenly out of the box आपको प्रोनेशन एंड सुपाइनेशन, ऐसा क्वेश्चन आता है. प्रोनेशन एंड सुपाइनेशन. The axis of pronation and supination passes from radial head to ulnar head obliquely. Okay, the radial head to ulnar head is obliquely, and that's how radius moves over the ulnar. Pronation is brought about by pronator teres, pronator quadratus. Supination is brought about by supinator and biceps brachii. In mid-flex position, biceps brachii is a strong supinator. इतना सब आप पढ़ के जाते हो, सडनली आउट ऑफ द बॉक्स फर्स्ट कार्पो मेटाकार्पल जॉइंट आता है एग्जाम में, और वो जोर का धक्का लगता है धीरे से. फर्स्ट कार्पो मेटाकार्पल जॉइंट, जिससे आप ठेंगा दिखाते हो लोगों को. ओके, that is between the scaphoid and the base of the first line. Trapezium, right? Trapezium and the base of the first metacarpal. It is a saddle variety of joint. Saddle variety of joint. It is a capsule, then lateral कार्पो मेटाकार्पल लिगामेंट. फिर इसके एक्शंस क्या रहेंगे? ये जॉइंट देख के ज़्यादा घबराना नहीं. इसके एक्शंस क्या है? एक तो फ्लेक्शन है थंब का एक्सटेंशन है, देन अबडक्शन, एडक्शन, देन opposition and circumflexion. Opposition. Okay, so flexion is brought about by flexor का pollicis longus, flexor pollicis brevis, and also opponens pollicis. So the muscle which causes opposition causes flexion, muscle which causes flexion causes opposition. The extension, तो ये बहुत easy है now. Things become easy for extensor pollicis longus, extensor pollicis brevis. Abduction, abductor pollicis longus and brevis. Adduction एक ही है, adductor pollicis. That is one of the short muscle. उधर longus brevis कुछ नहीं. Okay. Opposition brought by opponens pollicis and flexor pollicis brevis. आरती मैडम. And then we start with the nerves. But learning the nerves of the upper limb is incomplete without brachial plexus. तेरा चश्मा निकल गया है ना? भूल गया. दिख रहा है कि मैं क्या कर रहा हूँ? C5, C6, C7, C8, T1. C5, C6 upper trunk, C8, T1 middle trunk, C7 single continues and forms the middle trunk. Each trunk gives a division: anterior division, posterior division, anterior division, posterior division, anterior division, posterior division. Let this be called as anterior and posterior. So 3 posterior divisions unite to form the posterior cord. Anterior division of the lower trunk continues as medial cord. Now these 2 anterior divisions, remaining 2, unite to form the lateral cord. Only one nerve starts from C5 directly, nerve to rhomboids. C5, C6, C7, nerve of Bell, nerve to serratus anterior. From the upper trunk, suprascapular and nerve to subclavius. Suprascapular and nerve to subclavius. Lateral cord, LML, lateral pectoral, musculocutaneous, which pierces the coracobrachialis, and lateral root of medial. Medial cord, M4U, made for you, M4U. Medial cutaneous nerve of arm, medial cutaneous nerve of forearm, medial pectoral. Okay? Medial root of median and ulnar. So this continues as ulnar, this becomes medial. Posterior cord. Posterior cord continues as radial. And it's upper subscapular, lower subscapular. Now to latissimus dorsi, which is also called as thoracodorsal. Now to latissimus dorsi and axillary. And axillary. So now let us study each nerve. Let us start with the important nerves first. Okay? Radial nerve. The radial nerve is its root value is C5 to T1. C5 to T1. Radial nerve is continuation of the posterior cord. In the axil, it lies posterior to the axillary artery, leaves axilla by passing through lower triangular space, along with profunda brachii artery. Then it passes through the radial groove. Comes out of the radial groove and it becomes the lateralmost structure in the cubital fossa. Lateralmost structure in the cubital fossa. सलोनी ये बहुत देर हो गया अभी लिखने के लिए, सब अपने आपके नोट्स में ऑलरेडी है, नहीं लिखना लिख लो. Okay? Now then it just continues as a thin nerve on the lateral side. Its branches before the radial groove, in the radial groove, coming out of the radial groove. As a division of branches. Okay? ली बाळा पॅरालाइज नको हो मी बोलल्यामुळे मजा करतो. Before entering the radial groove, it gives posterior cutaneous nerve of arm. In the radial groove, it gives posterior cutaneous nerve of forearm and lower lateral cutaneous nerve of arm. Before entering the radial groove, it supplies the medial and long head of triceps. In the radial groove, it supplies medial and lateral head of triceps. Narvikar, now to the medial head also supplies and conus. After coming out of the radial groove, it supplies three muscles: brachialis, brachioradialis, and extensor carpi radialis longus. Applied anatomy. Saturday night palsy. So दारू पीने से केवल लिवर ही नहीं खराब होता है, रेडियल नर्व भी खराब होता है. Crutch paralysis and injections. All this happens because of damage to the radial nerve in the radial groove. Okay? Now we move on to the next नेक्स्ट लेक्चर किसका है? नेक्स्ट is median nerve. Median nerve root value is again like ulnar C5 to T1, but this is from the anterior divisions. This is from the posterior divisions. Posterior divisions always supply the extensors, and anterior divisions always supply the flexors. Okay. Median nerve is lateral to the axillary artery. In the arm, it crosses brachial artery from lateral to medial side. And in cubital fossa, it is the medial most structure. Then it enters the forearm. Where most of it lies between flexor digitorum and enters forearm by passing between two heads of pronator teres. Okay, enters the forearm, where it lies mostly between flexor digitorum superficialis and flexor digitorum profundus. And then it passes below the carpal tunnel to enter the hand. In the superficial compartment, it supplies four muscles: pronator teres, flexor carpi radialis, flexor digitorum superficialis, and the palmaris longus. For the deep compartment, it gives one nerve called as anterior interosseous nerve. This anterior interosseous nerve supplies pronator quadratus, it supplies flexor pollicis longus, and it supplies the lateral half. It supplies the lateral half of flexor digitorum profundus. The lateral half. Medial half is by ulnaris. Then it enters here. It enters in the hand, where it supplies 4.5 muscles, and it supplies 3.5 superficial, 3.5 cutaneous, lateral 3.5 cutaneous supply. 1, 2, 3 digit and half of the ring finger. Lateral 3.5. What is this 4.5? Lumbrical 1, lumbrical 2, opponens pollicis, abductor pollicis brevis, and half, that is superficial head of flexor pollicis brevis. Nowadays they have removed this half concept. Okay, flexor pollicis brevis is completely supplied by the median nerve. Coming to the ulnar nerve. Ulnar nerve is continuation of the medial cord. Its root value should have been C8, T1, but it is C7, C8 and T1. It is medial to the axillary artery. Then, few centimeters above the elbow, it enters the posterior compartment and goes behind the medial epicondyle. Then it passes between the two heads of flexor carpi ulnaris, which is called as cubital tunnel, and it enters the forearm. And then it passes above the flexor retinaculum. It doesn't pass below the flexor retinaculum. Passes above the flexor retinaculum. Okay? In the forearm, it only supplies two muscles. In the superficial compartment, flexor carpi ulnaris. In the deep compartment, medial half of flexor digitorum profundus. Okay? And when it goes here inside, it supplies 1.5 cutaneous, medial 1.5 cutaneous. That is ring finger, a medial half and little finger. And it supplies 15.5 muscles. What are they? 4 palmar interossei, 4 dorsal interossei, 4 hypothenor muscles. Actually, there are only 3 hypothenor muscles, and palmaris brevis is the medial separate muscles. For those 4 muscles, lumbrical 3 and 4, adductor pollicis, and deep head of flexor pollicis brevis. Nowadays you should stop writing this deep head of flexor pollicis brevis. आपके इसमें क्या दिखा है? Deep head of flexor pollicis completely. So flexor pollicis brevis, that superficial head was by this and deep by this concept is gone. Okay. So now it has become 4 and 16. 2 more nerves and I'll stop. One is axillary nerve. Branch of the posterior cord, root value C5, C6. It is posterior to the axillary artery. Posterior to the axillary artery. Okay. And it passes through the quadrangular space, then enters the substance of deltoid, divides into 2 divisions, anterior and posterior divisions. Anterior division accompanies posterior circumflex humeral artery. Posterior division is further posterior. तो हम लोग ऐसे अगर ह्यूमरस दिखाते हैं, ऐसे डेल्टॉइड दिखाते हैं, आर्टरी ऐसी है, एंटीरियर एंड पोस्टीरियर सर्कमफ्लेक्स ह्यूमरस, एंड एक्सिलरी नर्व इज लाइक दिस. So this is anterior, posterior. This is anterior circumflex humeral. This is posterior circumflex humeral. So anterior division of axillary accompanies posterior circumflex humeral. Okay. So its branches are branches M, MAC, V. Vascular go to axillary artery. Cutaneous is upper lateral cutaneous nerve of arm. It supplies the skin over the lower half of deltoid. Articular go to shoulder joint. And muscular supplies deltoid. And posterior branch also supplies teres minor. Supplies the teres minor. So 2 muscles supplied by axillary nerve. काटते या नहीं? तो सॅटर्डेला नव्हती आणि संडेला तो कोणाचा मीट? संडे को कौन कौन गया था बाहर? आपको बोला था बाहर नहीं जाने के लिए, नोटिफिकेशन था. Musculocutaneous nerve, branch of the lateral cord, C5, C6, C7. It is lateral to the axillary artery. Leaves axilla by piercing coracobrachialis. Lies between biceps brachii and brachialis. MACV, M-A-C-V. And then it goes down and further continues as lateral cutaneous nerve of forearm. So उसका cutaneous branch is lateral cutaneous nerve of forearm. Articular branch is to elbow joint. Vascular branch is to brachial artery. And muscular branch is to biceps brachii, brachialis and coracobrachialis. That completes all the nerves with brachial plexus. Okay, thank you.